name is Dr. Chris Kalhorn. I'm the Director of the Surgical Movement Disorders Program at MedStar Georgetown Hospital. That means I help take care of people with movement disorders such as Parkinson's disease, essential tremor, and dystonia. That also includes caring for people with epilepsy as well. Surgery is really very effective for movement disorders, in particular Parkinson's disease, essential tremor, and dystonia. When people are taking medication, but the medications are no longer working to help control their symptoms, then surgery is sometimes appropriate to help improve their quality of life. I think the most rewarding aspect of my job is that we have really fantastic patients at MedStar Georgetown. They come to us with very difficult problems. Sometimes they're very challenging to treat. They have extreme difficulty with movement. They can't get around. They have a lot of side effects from their medication. And for some of those patients, we're able to offer them deep brain stimulation surgery and help restore a more normal life to them. The technology has really improved drastically over the past 5 to 10 years. Worldwide, we've treated approximately 80,000 patients with deep brain stimulation effectively. For a number of our patients, the surgery can mean the difference between being able to roll over in bed on their own in the middle of the night, to get up out of bed by themselves in the morning, and just to perform a lot of everyday tasks that all of us take for granted. Eating on their own, brushing their teeth, going out, doing their shopping are some examples. MedStar Georgetown is a leader within the field of DBS. We're the very first center recognized as a center of excellence in the Washington, D.C. area for our care of people with Parkinson's disease. We have a multidisciplinary team that's uniquely suited to treat patients with movement disorders. This consists of neurosurgeons like myself, movement disorder neurologists, physical therapists, occupational therapists, speech therapists, all who have dedicated their careers to the treatment of Parkinson's disease and other movement disorders. I love my job because it's very dynamic. Our field is constantly changing, and being in an academic setting, we're forced to constantly think about new developments in neurosurgery, and we have really a unique privilege of being able to help care for people with movement disorders. A movement disorder is characterized by any disease that results in abnormal movement. A great example of that is Parkinson's disease, which causes tremor, slowness of movement, stiffness of movement, or what we call dystonia, or sometimes abnormal dancing, twisting type movements that we refer to as dyskinesia. These are very unique problems within neurosurgery and neurology that require subspecialty level of care. Deep brain stimulation is a surgery that's actually been around for quite some time, over 20 years. It's a surgery that consists of placing electrodes in a very precise manner in different target areas of the brain, and then connecting those electrodes to what we call an IPG, which is a brain pacemaker similar to a cardiac pacemaker that sits in a small soft tissue pocket overlying the patient's chest. The real advantage of DBS surgery is that it's effective in treating movement disorders. The surgery can be used to treat symptoms on both sides of the body, and it's also reversible, such that if we're able to discover a cure for these movement disorders in the future, the device can be removed. We can also adjust in a non-invasive way the settings on the deep brain stimulator over time, so that as the patient's symptoms progress, we can still help to treat their motor symptoms. DBS, specifically in Parkinson's disease, is very effective for tremor. It's effective for slowness of movement, or bradykinesia. It's effective for dyskinesia, and it's effective for dystonia, or abnormal muscle cramping. Unfortunately, DBS is not a cure for Parkinson's disease, and it doesn't take the place of the medical management of Parkinson's. However, it does represent very significant quality of life improvement. We know from detailed studies where patients have either been selected to undergo a trial of best medical management alone versus best medical management plus deep brain stimulation, that those patients do much, much better in terms of their motor symptoms. So while it's not a cure for Parkinson's disease, and as best we know, it doesn't slow the progression of the disease, it still can substantially restore motor control. Some centers do have an absolute age cutoff for DBS, and at our center, we feel that it's very important that you look at the individual patient. That's one of the missions of our hospital, is care for the whole person, and we don't have an absolute age cutoff. We look at the physiology of the individual person, and so long as they're medically able to undergo the surgery, then we don't exclude anyone on the basis of their age. It's appropriate to consider DBS surgery when people are having more motor symptoms despite adequate doses of medication. So for our Parkinson's patients, when they're having more and more what we refer to as off time, or periods of freezing, periods of bradykinesia or slow movement, they may take their dose of Sinemet or levodopa, and the medication may only work for 15 to 20 minutes. And until they take their next dose 3-4 hours later, they have significant difficulty with their movement. Or if people are having motor symptoms that are not being well controlled with medication alone, then I think it makes sense to at least consider getting an opinion from a movement disorder neurologist about whether or not DBS is appropriate. DBS is a very safe operation, and experienced hands in our center has done several hundred DBS procedures. The risk profile of the surgery is very similar to many other surgeries, such as elective carotid endarterectomy. The risks of surgery include things like bleeding or infection, or the possible need to reposition the electrode if the patient is having a lot of side effects when we go to program them. So with DBS surgery, oftentimes we can see results while the patient's on the table. We have our patients awake for the electrode implant, and while they're awake with us in the operating room, we connect the electrodes to a temporary battery pack, and we can see improvement oftentimes immediately in the operating room. From placing the electrodes, there can be some microscopic swelling that can occur that can also lead to symptomatic improvement even before we've implanted the battery pack or programmed the device. But the ultimate benefit that patients get from the DBS system does not occur until the device can be turned on, or what we refer to as programmed, in the outpatient office setting. DBS is a surgery that does not occur in a vacuum, and placing the electrodes properly is just one very critical part of the entire process. Of course, you absolutely cannot neglect the importance of programming, and our team are really experts in programming deep brain stimulators. In fact, our movement disorder neurologists are called upon to lecture on this topic nationally and to help other neurologists sometimes with programming challenges. So programming is an art in and of itself, and without the attention to the proper programming after DBS surgery, the patients will not have the optimum result. Our center does use microelectrode recordings intraoperatively. This is a way that we can verify that the electrode is in the proper position before we implant the permanent electrode. Not all centers utilize microelectrode recording. We work very closely with a dedicated neurologist, neurophysiologist, Dr. Alan Mander, who helps us with this process of microelectrode recording, and we think it leads to better surgical outcomes. So right now, the main movement disorders that we're treating with DBS are Parkinson's disease, essential tremor, and idiopathic generalized torsion dystonia, or what we refer to as dystonia. A patient should consider MedStar Georgetown for their DBS surgery, I would say predominantly because of the multidisciplinary nature of our team. MedStar Georgetown has been recognized as a center of excellence by the National Parkinson's Foundation. We're the only center of excellence within the Washington, D.C. area. Our multidisciplinary team of individuals has dedicated their careers to the treatment of Parkinson's disease. We consist of a team of neurologists, neurosurgeons, anesthesiologists, neurophysiologists, physical therapists, occupational, and speech therapists who are all uniquely suited to care for people with movement disorders. DBS is really a life-changing operation for a number of our patients, and it really is the most gratifying operation that I perform within my practice. It's very, very satisfying to see patients from their level of function before surgery, to care for them through the DBS surgical procedure, and then see their motor results afterward. And it's just very satisfying to hear their stories and the things that they're enjoying doing after surgery. When we're talking about Parkinson's disease, we want to make sure that we are dealing with true Parkinson's disease. There's some other movement disorders that can look like Parkinson's or mimic it, but that are not Parkinson's disease, that should not be treated with DBS. Also, if people are having significant cognitive impairment or dementia, then they may not be a candidate for DBS. This is all part of the preoperative screening process that we carry out at our institution.